Hello. Today I'm going to talk about some soft tissue mobilization around the elbow. For this, if there is any kind of injury at the elbow, a strain, sprain, any kind of nerve entrapment, then soft tissue mobilization of the muscles and the tissues, ligaments, is a good idea in order to make sure that everything is moving properly. Okay, so I'm going to pretend like my right elbow is having problems. So I'm going to just feel around here and I'm going to use my hands. You can also use other things like a golf ball, tennis ball, lacrosse ball, even massage ball. If you have a Theragun, that works as well. But I'm going to find, and this is a nice spot right here, where it's nice and tender, and I'm going to kind of go around that area. Okay, so right now I'm probably kind of on the pronator teres. Pronator teres attaches to the medial epicondyle, which is right here. Lateral epicondyle is right here. Okay, so for that area, these areas tend to be pretty tender because we use our arms a lot, or at least for those that use their arms a lot. I'm a manual physical therapist, so I'm constantly using my hands. And so these do get tender. So I'm kind of going to go around on that bony notch. I'm going to rub right along it where it feels nice and tender. Go in there. It's not going to feel comfortable. I'm going to continue doing it. I might get a little sensation in my hands, which I am right now, because the median nerve travels right around that pronator teres, which can give you pronator teres syndrome. You can also get anterior interosseous nerve syndrome. That's just a motor nerve syndrome, so that won't give you tingling in your hands like I have right now. Okay, so I might work on that. Lateral epicondylitis, also known as tennis elbow, that's going to affect these muscles right here. So you can also get those nice and tender right here. So I'm going to go for that. So whatever you have, or wherever it's tender, then I would go ahead and spend 3 to 5 minutes working on it. Okay, like I said, you might get a golf ball, press down on it, and really get into those spots right there. Like I said, you might use the lacrosse ball. Theragun would probably work really well. My hands work fantastic because I'm used to doing this all day long. And so if you can really find it with your hands, that almost works the best. But anyway, so spend 3 to 5 minutes. Make sure that it's fairly uncomfortable. You don't want to bruise yourself. You just want to loosen up that tissue. Okay, so after you're done with this, then I would suggest going ahead and doing some nice wrist stretching for stretching those flexors and extensors, maybe in the pronator teres if you need to, after you've released all that tissue. All right, so that's what I have for you today. I hope to see you next time.